Magandang oras, Ilocos, and welcome sa pinakabagong show ng Core TV, Ang Cure. Ang programa kung saan tumatalakay sa ating kalusugan. At dito, maliliwanagan tayo sa mga karamdaman kung saan marami tayong mga tanong kung paano nakukuha ang isang sakit at kung paano ito maiiwasan o magagamot. Ngayong araw na ito, ako ang makakasama ninyo para magtanong sa ating mga resident doctors. And it's my pleasure to introduce to you our 3 resident doctors. Our first doctor is a surgeon and holds his clinic at St. James Hospital. Please welcome one of the top calibers, Dr. Dennis Rivas. Welcome to the show, sir. And our next doctor is a pediatrician and does her clinic at Gabriela Silang General Hospital and in her own residence at Liberation Boulevard, Vigan City. Please welcome the very lovely Doctora Blandina Suarez. Hi, Doc. And finally, our last doctor is a neurologist and holds his clinic at St. James Hospital. Please welcome ang kilabot daw at ang heartthrob in the field of medicine. A big round of applause to Dr. Elton Ong. Hello, doctors. Welcome to our episode for today. You can greet po yung mga televiewers natin.
Hi, everybody.
Yan si Doktora. Napakaganda mo, Doktora.
Sabihin ko, magandang araw.
Oo, magandang araw. Dr. Rivas.
Hello to everyone and all the televiewers of Core TV and this segment, Cure. I hope that you will be enlightened with what we have to discuss today.
Exactly, Doc. And I am so excited and so privileged to be part of this show kasi kailangan ko rin malaman yung mga dapat kong gawin, mga tips natin para maging tawag nito, para maging handa sa anumang klaseng sakit na meron tayo. At maswerte po tayo ngayon kasi ang pag-uusapan po natin ay ang sakit ng kahit anong klaseng tao, kahit anong estado at walang edad na pinipili, ito ang sakit na stroke po. Dr. Elton po, ano po ba yung stroke na sakit po?
Yung stroke, simply put, is actually brain attack. So, atake dun sa brain. So, but first things first, I think we have to clarify yung word na atake. Some people kasi get confused with the word atake. So, people sometimes, might think that atake is atake sa puso or atake sa brain. So, there are actually 2 different kinds of atake. So, yung sinasabing heart attack or myocardial infarction is atake sa puso, wherein the blood vessels or yung mga arteries dun sa puso ay nagkakaroon ng bara. So, people with heart attack will actually complain of chest pains, nahihirapan silang huminga, o kaya madali silang mapagod. On the other hand, yung stroke is an atake dun sa brain. So one of the arteries in the brain gets a problem, so it's either nagbara o pumutok, and then people with brain attack will manifest with symptoms na sudden onset ng symptoms referable to the brain functions or dysfunction of the brain, katulad ng weakness on one side, nagbubulol, or hindi makakita, or a combination of those symptoms.
The usual na effect talaga, Doc, pag ano. And parang may nabasa din kasi ako na during my research din, parang yung may problema sa pag-flow ng blood natin. So yun yung nakakaano din.
So there's a problem in one of the arteries that would bring blood and oxygen to the brain, and because of that, since there's a problem there, magkakaroon ng problem dun sa function ng particular area of the brain that is affected. Okay. And since the brain controls every part of the body, so people with brain attack or stroke will manifest with weakness, yung mga symptoms of or signs pertaining to a problem in that particular area of the brain.
Okay, Doctora, do you have any question for that?
You said a while ago that one of the symptoms could be referable to the brain or the central nervous system. So, headache probably is very significant in these patients. And is there a particular or a characteristic type of headache that will warn someone that this could be an impending stroke?
Actually, we will be discussing that later on. Pero yung usual na characteristic na headache ng patients with stroke is a very, very severe type of headache. Yung parang sudden onset, biglaan na talagang biglang parang sumakit ng ulo na never pa nilang na-experience yung ganong klaseng sakit ng ulo. And that's actually a warning sign na you really have to go and see a doctor right away.
Okay, what about you, Doc?
I would like to ask Elton if do you always have loss of consciousness when you are having a stroke?
Not necessarily. Most of the time, kung hindi grabe yung stroke, walang loss of consciousness. So,
Okay, so those are some of the questions lamang. No? Pero alam niyo po ba na ang stroke ay number 2 killer disease sa buong mundo at number 2 leading cause of death in the Philippines based sa census ng Department of Health noong 2002. Ano-ano po ba ang mga dahilan at nagkaka-stroke ang isang tao at saan po ba nakukuha ang stroke po, Dr. Elton?
naku, medyo napakahabang tanong niyan. So, because if we're going to discuss, all the reasons or mga risk factors why a certain person, is predisposed to stroke, it's going to take us like forever. Pero generally, so I think we should just discuss or mention the ones that are common. So, generally, we can classify yung mga reasons or dahilan kung bakit nagkaka-stroke ang isang tao or sanhi ng stroke into the modifiable and non-modifiable. So, risk factors. So, pag sinabi natin kasi non-modifiable, wala na tayong magagawa dun, katulad ng age. So, hindi natin pwedeng pigilan ng isang tao na tumanda. And we know that stroke is actually more common in the elderly. Although, pwede rin mangyari siya sa bata. Pero mas madalas kasi nangyayari sa mga matatanda. And then, family history is also one of the non-modifiable risk factors. Kasi if both parents had a stroke, then malaki din yung chance mo na ikaw magkaroon ng stroke pagtanda mo. So, may hereditary na component. And of course, so, yung mga non-modifiable risk factors would include the risk factors or mga dahilan na pwede nating gamutin or pwede nating i-prevent. And these include, of course, the most important of which is actually hypertension. So high blood, diabetes, mataas ang cholesterol mo, smoking, excessive alcohol intake, a stressful lifestyle, or lack of obesity or medyo overweight. And of course, yung sedentary lifestyle or kulang sa activities.
Sa activities talaga. So talagang parang na-tense naman ako doon. Kasi sometimes sa trabaho ko rin na-stress din tayo because sometimes hindi tayo nakakagol or something. We wanna achieve something pero hindi mo nakukuha. So sometimes na-stress ka talaga. So factor din pala yun, Doc, no? So it's a way of the kind of lifestyle also. So parang paalala lang sa mga mahilig uminom at saka yung mga mahilig mag-smoke dyan. Tigilan na natin yung mga vices na yan kasi hindi nakaka...
Don't look at me like that, Dr. Ong.
But anyway, pwede man natin ipaalam sa ating mga tagapanood kung ano po ang nagiging epekto nitong mga modifiable and non-modifiable risk factors sa ugat ng utak natin. At ano ba ang mga klase ng stroke, Dr. Ong?
Diyan na yung papasok yung sinasabi mo kanina na may problema dun sa artery, dun sa brain. So kasi yung mga both the modifiable and non-modifiable risk factors eventually would lead up to damaging yung mga blood vessels or arteries sa brain mo. A process that we call atherosclerosis. Yung atherosclerosis kasi, it's a gradual process that usually starts during childhood pa Kapag kumakain ka ng mga maalat, matataba, di ba? So nagkakaroon ng mga deposit ng taba dun sa mga artery mo na nagsusupply ng oxygen dun sa brain. So eventually, habang tumatanda ka, lumiliit yun. So pakonti ng pakonti yung mga daloy ng dugo sa brain until eventually, so pag sobrang nagbara na yan or pumutok yung ugat na yun, then you develop a stroke. So based on what happens to the artery, so you have actually two different kinds of stroke. And it's important, for us to recognize that kasi treatment for both conditions are not the same or they're different. So yung most common is nagkakaroon ng blood clot or nagkakaroon ng bara dun sa artery na yun. And that's what we call yung infarct na sinasabi or ischemic stroke. So because of the fact na nagkulang na yung oxygen sa brain because of the bara, namamatay yung mga neurons or yung mga nerve cells. And that could lead to a dysfunction in that particular area of the brain. Kaya ka nagkakaroon ng paralysis o pagmamanhid or pagbubulol. Tapos yung isang klase naman, yung ugat, pumutok. So pumutok yung ugat, lalabas yung dugo, and yung dugo would compress on the brain tissues, leading also to death of yung mga nerve cells.
So ano yung mas delikado doon?
Mas madalas na nangyayari yung infarct, yung ischemia. Pero mas delikado yung malalaking hemorrhage kasi pwede mo siyang ikamatay kagad. And those are the ones that would present with loss of consciousness at the beginning kasi sobrang taas ng pressure, pwede kang mawalan ng...
Those with hypertension.
specifically for those with hypertension yung hemorrhage. Pero pareho silang delikado.
I see.
Kasi we're pertaining to a dysfunction or death of neurons or brain cells, di ba? So, pwede mo siyang ikabaldado or kimatay. So, pareho silang delikado.
Doktora, do you have any follow-up
Yeah,
question
is
for
there
that?
such thing as transient attack or transient brain attack, if you might call it?
So, meron tayong sinasabi na mini stroke or parang TIA or transient ischemic attack. Very stroke-like din ang presentation niya. Talagang manghihina ka, biglaan din, ganun. Pero usually nagre-recover sila within less than 24 hours. Pero parang most of the time nai-ignore yan eh. Di ba kasi parang sabihin, oy, baka nagpasma lang ako or may naipit lang na ugat. Pero it's very important, for us to educate the public and make them realize na yung TIA or mini stroke is parang a warning sign that there's
Could
another
lead to a
stroke, big stroke that's
to a
coming.
bigger
So
one.
you have to go to see a doctor right away.
I see. Doc, may question lang ako. Doon ba sa halimbawa yung mga basketball players, mga ganyan, usually pag nagba-basketball sila, pagod, and then meron kasi yung mga naliligo agad. So, may connection ba yun?
Walang connection.
Wala
Pasma.
naman. O,
Yun yung
pasma.
pasma na sinasabi nila.
Oo.
Walang gamot doon sa
Walang
pasma.
gamot doon.
And there's
But
no
anyway.
medical explanation for that.
Okay. So, ayan po mga kaibigan, bago po tayo magpatuloy sa ating usapan, let's just pause for a few break. Magbabalik po ang Cure.